So before we even start the press conference, I'm going to ask the media to put something out. With all these kids home, parents are looking for something to do, and we definitely don't. We want to out getting fresh air, not on the playgrounds, and we'll address that in a minute. But I'm going to challenge the kids that are out there. We have Shaker Place Nursing Home that has been locked down. A lot of seniors that are up there. Nursing homes around the county. So we're going to say, kids, parents, get on your computers, do some cards saying thank you, we're thinking about you, whatever you want to do, and send it to us. We actually set up a website for e-cards where you can do wishing them well, do drawings for them, anything in that nature to brighten it up, and actually parents to keep your kids a little bit busy. So it's going to be at Albany County Kids Care. That's Albany County Kids Care at albanycounty.gov. And please, parents, we'll give a 10-minute project with them on the computer, doing some drawings or some well-wishing. We'll go a long way with our seniors at our Shaker Place. And if we get overwhelmed, and I hope we do because the kids are home right now, if we get overwhelmed, we'll send them to the other nursing homes. And this way, we're not contaminating anyone. You're going to do it on the computer, and we're going to send it out that way. So again, that's Albany County Kids Care at albanycounty.gov. So, just a couple things. We said this is going to be moving, right? I commend the governor and his team for the great job they're doing leading New York State, not only New York State, but this nation. But most importantly, we are very aggressive with testing, and the governor has been. Well, there's been a problem. We're running out of tests. So as you know, Albany Med has stopped doing the drive-through tents. St. Peter's Health has done the same thing because we need more. We need more test kits. We need more supplies, and I'll get into that in a second. But they're actually backdated too. There's been a lot of negatives, so I want to emphasize that. There's a lot of negative tests too, but a lot of positive. In our numbers, and Liza and I, and I'll let Dr. Whalen talk about this in a minute, we were talking how, look, you looked at one point, one night we went from 40 to 42, and we're like, great, maybe it's kind of peaking out. But the problem was that the laboratory was overwhelmed with all the kits that were sent into them to test. So as you know, yesterday we announced one number, and as of today, as new numbers are coming in, we are now at 70 confirmed positive cases. That's 70. We were at 52 last night. We are at 70 right now. And if you look at when this first started, March 12th, we had 2 cases. Within 4 days on the 16th, we're up to 15 cases. 4 days later, we're up to 70. So just do the math, people. It's we haven't hit the spare yet. We're probably going to see more numbers. At all them cases, 2% are all confirmed positive cases. Testings have ramped up, like I said, but 283 people are going under mandatory quarantine. 498 people are under precaution quarantine. Obviously, that number will grow as the day goes on, and we would love to continue to keep you updated. But again, we're relying on tests coming back from laboratory that let us know what direction that we're going into. As of yesterday morning, Albany County had tested roughly 1,019 people so far, the 3rd highest outside of New York City. In the governor's last executive order requiring business to cap their workforce to 25%, I think everyone got what businesses are talking about, but essential services like garages, gas stations, grocery stores, stuff like that doesn't have to apply because they're essential services. Same thing with governments. They let us know we're good at the 50%. We don't have to apply to the 75%. But we have healthcare workers, and I want to commend the men and women on the forefront of this, our nurses, our doctors, our CNAs, our LPNs, respite care, you name it, all of them that are out there every day protecting us, going to work. Can't thank them enough, the men and women that protect us in the police and fire and EMS service, and especially our Department of Health for everything that they're doing down there around the clock. Can't thank them enough. I want to commend the legislature for taking quick action on the paid sick leave that gives people with COVID-19 2 weeks off sick. That was a good piece of legislation they put through on Wednesday. But also, we received a $200,000 grant yesterday that will continue to help with this epidemic we're in, with things like emergency operations, surge in staffing, and infectious control that came from New York State yesterday from the governor's office to help fight what we have going on here. So with everything going on, one of the other issues that concerns we're really going down the road with is mental health. It's different times. People aren't used to this, and this is why I say to everyone, you know, listen, Albany County residents, New Yorkers, we're at our best when stuff like this happens. You have to take a step back. You have to take a deep breath. Things are changing. Things are changing all around us, and it's going to change for the near future. We're going to be looking, probably be in this mode maybe a month, maybe less, maybe more. There's no need to panic. Relax. We're going to get through this because we're New Yorkers, but people do have issues, you know what? And just because you're stressed, you can handle stress better than, say, someone over here, it doesn't mean you're weaker. It just means that, you know, you might want to talk out to somebody. People that are watching this or listening to this, that want to talk to somebody or just have an issue, and, you know, don't be afraid to call. So we have that number. I want to put that number out there again. It's area code 518-269-6634, 518-269-6634. It's going to be available from 8 a.m. to 5 p.m. 7 days a week. So it's just not for the people quarantined. It's for just people that might have an issue, that something's bothering them. Because again, the world's changing. Look around what's going on. Be prepared and be kind to your neighbors. So we have that going on. The governor has done an excellent job on calling on the federal government for more supplies. We need it. We're running out. We're running out of supplies. So the people that have stocked up on masks and gowns and everything like that, please get them to the hospitals or get them down to us, and we'll get them out to the people that need them. They're running short at hospitals. They're running short around not just Albany County, but around the state of New York. I commend the governor on trying to get stuff like this, the N95 mask, the Clorox wipes, the gloves, the course test kits, all this stuff. Please, Mr. President, please get this stuff to us quicker. We need it, because the only way we're going to stop this is by having the right tools to fight it. And without the right tools, it's going to be harder. So we need the stuff to keep our medical professionals in the game, to keep them protected so they're protected when they go home to their families. So again, please, we need this, because it's the lack of testing kits that local hospitals are preserving, trying to staff the patients and everything else going on. I say to everyone out there, times are changing, but it's not time to panic. It's time to be the people that we are of this great state of New York and this great county. It's time to help one another. It's time to work with one another. It's time to take care of one another. So please, again, check on any of your neighbors that might be alone. And even if they're not alone, it's kind of nice. You know, you can look at, if you live close enough to somebody, you can look at each other's windows and make faces at each other, laugh, talk about this, and get through it. And we are going to get through this. We're going to get through this because we got a great leader in our governor, great leader in our state, and all of our health professionals. This is the best place to be if something for this to happen is in the state of New York, in my opinion. I'm going to be a little biased, state of New York. I love it. So, again, we also established the 211 number with United Way. I can't thank them enough if you have any questions on COVID-19. And the New York State hotline is 888-364-3065, 888-364-3065 to address any of the issues there. Businesses that are closed, which we talked about, which everyone should know now: casinos, gyms, movie theaters, bars and restaurants, shopping malls, amusement parks, bowling alleys. And effective tomorrow at 8 p.m., barbershops, hair salons, and hair removal and related personal care services will all be shut down tomorrow at 8 o'clock. Just so everyone knows. And again, don't forget, if anyone has face shield goggles, the Clorox wipes. We are trying to get the hand sanitizers, the gloves, size medium we're running out of, believe it or not. That's what we're looking for. Surgical masks, anything in that nature that can help out would be appreciated. And at this point in time, I'm going to turn it over to Dr. Whalen.
Thank you, County Executive McCoy. I can confirm that as of today, we have 70 cases of COVID-19 that have been diagnosed in Albany County. When you look at the cases, they range across all age spans. Our youngest patient is 3, and our oldest is 90. Of the 70, 6 have required hospitalization. Most people have recovered well and are progressing well at home. We continue to actively track contacts to ensure that we are appropriately quarantining contacts to keep them out of the public. And again, I'm going to continue to reinforce the message to stay home. The development around the lack of availability of test kits is problematic. This gives us a very difficult task of seeing how this is unfolding in our community. And if we look to other communities that have had similar outbreaks, we know that we are only at the start. So we have a couple of early data points that indicate that the cases are rising in the community. And if we do not have availability of tests, those data points dry up. What I do not want to happen is for the public to get a false sense of security from this. Our inability to diagnose more cases does not mean that there are not more cases. The likelihood is, as we continue to investigate these cases, we are seeing the majority of them are community acquired. So that tells us that this is in the community and people need to act accordingly. So all guidance, measures, legislation that's being put in place around social distancing should be taken very seriously.